In Jamaica, Monday, April 27 marked the launch of Vaccination Week in the Americas 2015 under the theme Boost Your Power, Get Vaccinated. Speaking at the launch at the Maxfield Park Health Center in Kingston, Minister of Health Dr. Fenton Ferguson urged parents to continue the trend Jamaica has been setting in its fight against preventable diseases. The minister, stating that Jamaica has a high of 90% vaccination coverage, used his moment at the mic to recognize the work of the Pan-American Health Organization PAHO in the vaccination efforts of the region.
Because the revolving fund, most innovative fund, but it has made a tremendous difference in access to vaccines, for cost-effective vaccines. And it is to that extent that nation states within the Americas have been able to have easy access. Mark Connolly referred to the HPV vaccine earlier. And even as we speak, I know that PAHO is in discussions working to get the price of that vaccine down, because it now stands as an hindrance to developing states having access to. But I can tell you and I can promise you that on my watch, we are going to introduce HPV vaccine in this country.
Minister Ferguson says he believes nations in the Americas have a tremendous responsibility to take care of their infants. He says the task should not only be left on the shoulders of the parents.
This is why I want to commend the government in the period of the 1970s that have strengthened the legislative framework, that have also put Jamaica in a position where, unless there is good medical evidence, all babies born in Jamaica, there is a responsibility in law for them to be vaccinated. So we haven't gotten to 90% by accident. It is by design relative to law. It is by design relative to a commitment to dealing with one of the most preventable action that any government can take in terms of prevention of mortality and even morbidity relative to our population.
Noting the recent outbreak of measles in the United States and some parts of Central America, Minister Ferguson highlights that the country has made significant strides in healthcare.
I think we sometimes beat ourselves to say we have the worst system in the world and all of this nonsense. But when you compare the health outcomes, life expectancy, female about 75, male about 73, that is comparing favorably with developed countries with a spend much smaller than many of the developed countries. Immunization, when you look at our achievements versus developed states and immunization, far ahead. When it comes to the primary care, Jamaica back in 1978 at the Alma Ata conference was pronouncing strongly in relation to primary care. Our network of primary care centers across the country is far in advance. I see the United States fighting now. They call it another name, but trying to set up primary care centers and trying to set up centers of excellence. Jamaica, we are far ahead.
Minister Ferguson adds that the government is taking steps to improve on the gains already made.
The Cabinet of Jamaica has now approved the primary care renewal policy that will take into account the population, the demographics, the epidemiological data to determine the type of primary care center that is best to respond to our people. We have the type 3s all over the country, but what they are able to do, the greatest number among over 300 are our type 1, 2, and 3. We now will be able to have a configuration that will fit into our townships and our parishes in a much more scientific way based on evidence.